Well, I'd just like to welcome everyone to the 27th W.O. McCormick Academic Day on Psychotherapies in Clinical Practice. We have a full house. Registration sold out in only 5 days, which I think is an all-time record. And I've been privileged to have already seen the program, and I can certainly assure you that thanks to both our invited and local speakers, you're going to find this conference, which has a lot of innovation and interactivity to it, to be not only very educational, but very enjoyable. And I'd also just like to thank our sponsors who have provided unrestricted educational grants in support of this conference, and would please encourage you to see their exhibits during the breaks and at lunch. So I'm sure everyone recognizes me since I've been doing this for some time. Associate Professor in the Department of Psychiatry, and I chaired the CPD committee there, and also I'm the chair of the planning committee for this program. Couple of quick housekeeping items, but important ones to ensure everyone has a positive experience. If your cell phones aren't already off or in these modes, please turn them to airplane mode or vibrate. Your conference program provides very detailed biographies of all of our speakers, as well as detailed abstracts of their presentations. There are 2 exits to this room, one on either side of the podium. So if you're on, obviously, this side, you would exit that way, and on this side, that way. And that's very important in terms of the nutrition breaks and lunch. And there are 2 different tables of food that will be set up. Wi-Fi is available, as you can see. And in terms of the question and answer sessions, we have 2 floor microphones, again, one on either side. So if you do have a question, please remember to line up behind the microphones, and you will be recognized by the chair. And evaluation, very important. We really need your feedback for future planning. You will have already received an email with this link to the evaluation form, but it's also available as of now. And you have until midnight, May 2nd, to complete the evaluation. As well, we are video conferencing all of the presentations for posting on the Department of Psychiatry website in about a week or so. And lastly, we do have some little prizes for some of you. You have to be here at the end of the day in order to get those. So it's now certainly a pleasure to introduce the Honorable Leo A. Glavine. He was first elected to the legislature from Kings West in 2003, but he's actually spent his entire life really dedicated to public service, including even a time as a firefighter. Currently, he's the Minister of Health and Wellness and the Minister of Seniors. And as I'm sure you can appreciate, he has a very busy schedule. So it's really a great privilege to have him here, and I'd ask him to come up and give some opening remarks.
Thank you so much, Dr. Heather, and good morning, everyone, and thank you so much for an invite to the W.O. McCormick Annual Academic Day. Mentioning being a firefighter, I sometimes get often asked, what helped you prepare you the most to be Minister of Health? And I sometimes come back with 2 things. Obviously, a life as a teacher, as a vice principal of a big rural high school, and having a wife, a nurse, certainly has acquainted me with much of the language of the healthcare system through the years. But I would say it is having coached 30 hockey teams that really prepared me for the rough and tumble of political life and maybe as Minister of Health with all its demands. I should remind Dr. Heather that, you really shouldn't assume being known by everybody, even in this room, I'm reminded of a story I heard from Peter Mansbridge just a couple of weeks ago that I actually related to Dr. Alan Abbas just a few mornings ago as we did our pre-day thinking and getting a little fitter for the day ahead as we meet each other often on the treadmill where we reside. But Peter Mansbridge was over in PEI. He flew in a direct flight from Toronto to speak at the Chamber of Commerce in Charlottetown. So he, busy day, get back to Toronto, prepare for the National, and so he was taking a smaller commuter aircraft to Halifax to get a direct flight to Toronto. And as he was walking across the tarmac, of course, they only have one gate in Prince Edward Island, so he said, I was told to use gate 1, and that was the first thing I realized how small the airport was. But he was walking across the tarmac, and the pilot opened the side window and said, "Oh, welcome on board the flight, Peter. Great to have you today on a short flip to Halifax." So his ticket showed seat 1A, and so as he gets up into the aircraft, he sees this very hefty 275, 300-pound man in seat 1A, and so he says, "No way am I going to disturb him and tell him, look, I'm ready to be in 1A." So he goes over and sits in 2A. So the stewardess is preparing for the flight and giving the instructions, and a little ring of the bell, and she's called to the cockpit, and she comes back out, and she goes over to 1A and says, "Look, the pilot would like to have you up front for the flight over to Prince Edward Island." And so him and the stewardess kind of get him squeezed in into the cockpit, and the stewardess comes back and said, "Oh no, that's just Peter Mansbridge riding to Halifax with the pilot today." So you never assume being known, Dr. Heather. But no, I'm really pleased to be here today and stand before educators, doctors, researchers, and many clinicians. I met a couple of psychiatric nurses as I came in this morning, and who all contribute to positive mental health and to the delivery of care for those who are burdened with a mental illness. We know that many individuals and their families across Nova Scotia are battling with, but many succeeding with, their own personal mental health issues. Psychotherapies, like many that you will discuss today, help one understand their illness and help them deal with unhealthy thoughts, situations, and behaviors. Stigma about mental health is eroding, and we are seeing more people seeking treatment. This is a good thing. I worked with colleagues in two big rural high schools of Nova Scotia, Horton High School and West Kings District High. And it would only be on a very rare or seldom occasion would you find out even about a colleague who was struggling with a mental illness. It just was not talked about. And we have come a long way in the past decade. Work to do yet? Obviously, yes. In many respects, Nova Scotia has been ahead of the curve as it relates to mental health treatment and creating awareness of mental health issues that people suffer from. 3 years ago, it's beyond that, we're into the 5th year, the province released Together We Can, a 5-year mental health and addiction strategy. And it has had an enormous uptake and an advisory group that has helped move the 33 recommendations out across the province. Many of them, however, still need to be enhanced. We just have a small number of our family doctors who have gone through a professional development of mental health training. And it's on that front line that we absolutely need more and more of our clinicians who have some of that insights to be able to work with patients and also recommend patients who may come for a medical issue but are really have a mental health issue overriding everything. Since releasing this strategy, Nova Scotians are experiencing greater access to mental health assessment, treatment, and care in their own communities. The trend is heading in a positive direction, although we recognize so much more to be done. As a provincial government, we spend more than $270 million a year on mental health and addictions. These dollars, of course, cover programs, doctors, social workers, medications, programming, treatment, and many other aspects of treating mental illness. We know that mental health and addiction challenges are not just an issue for governments or health authorities. They are a societal issue, a community issue, a business issue, a family issue. In many ways, of course, we all know that mental illness has always been with us through the eons of time, but I don't think I'm making any great prediction in saying that mental illness and all its elements and components, I believe, will be the disease that gets tremendous attention and research, and I believe improvement in the 21st century. I absolutely believe that to the core. We all have a role to play in ensuring a safe and welcoming community, and this is a challenge we can face together. To kick off today, I'd like to say how much I admire and appreciate all the work that you've done and continue to do to help those living with mental illness. When I took a look at the program, I kind of first thought it was more for the academic community, but I know that this is a very, very broad-based audience that work in many, many areas of mental health and across the province, and I think some from New Brunswick, probably student nurses, student doctors in this audience. So I thank you for the work you do and the work you will do in mental health. I also want to thank you again for inviting me. I'd like to congratulate Dalhousie on providing this opportunity to fuel discussion on positive mental health. In a very short time, we will be making an announcement about how we're going to handle development of the next 5-year mental health strategy in the province. And I hope many of you will take the opportunity to make submissions, to attend small workshops, and many ways of advancing this important work that you now do, but that we know we must do a much better job with, and especially in the early years. Thank you very much.
Thank you so much. Well, thank you very much, Minister. And as I mentioned, he has to dash off for question period. So it's now my pleasure to introduce Dr. Nicholas Delva. I think, as everyone knows, he's been head of the Department of Psychiatry for the past 10 years, and that actually is a position he's going to be leaving at the end of June. And I just want to say at the recent Department of Psychiatry biannual meeting, Dean Anderson was there, and he commented on the contributions that Dr. Delva has made, not only to the department, but to the Faculty of Medicine as well. So I'd now like to ask Dr. Delva to come up and give what will be his last opening remarks to an academic day group.
Thanks very much, Heather. Let's try and torque this up a little bit here. So on behalf of the Department of Psychiatry, I'd like to welcome you all here today, and certainly thank Minister Glavine for his remarks. I think the government is really aware of the importance of mental health, and it is a matter of marshalling all the resources that are in a healthcare system to really provide optimal mental health care and to provide equity, really, in terms of how mental health care is supported by the healthcare system. It's great to see a full house here. I see many familiar faces. I think the full house is due to the correct perception that psychotherapy is a really important part of mental health care. We've got a really excellent program here, and we've got two excellent visiting keynote speakers, Dr. Stefan Hoffman, who's over on my left, and Dr. Anne Mahoney, who we'll be hearing from this afternoon. And we look forward to hearing from our local experts as well, and I think it's really good to see the strength that we have here in psychotherapy. We've got expertise, we've got enthusiasm, and we've got excellent training opportunities for people, and of course ongoing research here. There's a lot going on in the world of psychotherapy research, and I think we'll get a bit of a glimpse of that today. Psychotherapy works. It's quite clearly evidence-based, and more work is being done all the time to find out exactly what works. And as we know, psychotherapy can be the best care, and sometimes it can be the only care that some conditions require. And psychotherapy is a part of many, many therapies, even when medications are quite important. I have a number of questions, of course, and particularly in my role as an administrator, you'll see reflected in these questions. So what works best? What are the psychotherapies that work the best? For which conditions do they work well in? Importantly, and this is a question for the minister, which maybe he can get through the ether here, how do we provide psychotherapy to those who need it in a system with limited resources? How do we provide psychotherapy efficiently? Should there be limits or controls on publicly paid psychotherapy? I think some of us have heard of the work of Paul Kurdiak, who's based in Toronto, looking at the distribution of psychiatric services in Ontario and finding some inequities, really. Sometimes too much therapy is being delivered to too few. So how do we make sure that everyone gets psychotherapy in an equitable way? How much should society invest in psychotherapy? I think many of us are aware that in the United Kingdom, a lot of investments have been made in psychotherapy, and that's a whole challenge really for society. How do you ramp up psychotherapy services even after you decide to spend the money on the psychotherapy? And I think a lot of money was invested in the UK in psychotherapy. And I could put a lot more questions to you. So I hope you have a great day. I'm sure we'll all learn a lot. I'd like to thank Dr. Milliken and the Planning Committee, and Tracy Fraser-McIsaac, and the other administrative staff who put this day on. I think you can imagine it takes a lot of doing to put on a day like this. So have a great day.
Thank you. Thank you very much, Dr. Delva. And I'd now like to introduce Dr. David Pilon, who's a psychologist. He's the former program leader for the Mental Health and Addictions Specialty Services, and has recently assumed the position as program leader for the newly created Education and Training Program in the Health Authority Central Zone Program. And he's here to provide some opening remarks on behalf of Trevor Briggs, who's the director of the Mental Health and Addictions Program for the Central Zone and could not be here today.
Thank you, Heather. Good morning. It really is a pleasure to contribute to the welcome of our attendees today on behalf of the Mental Health and Addiction Program of the Nova Scotia Health Authority. With the focus of evidence-based practice within medicine and healthcare within the last 15 years or so, it really was only a matter of time before the lens of treatment for mental disorders came to be focused upon psychotherapy. We know from research and clinical expertise that psychotherapy works. We know that specific types of psychotherapy are indicated for specific populations, and the field has matured to identify ingredients of change, mechanisms of change, factors related to patients and context. And today's presenters really do reflect the best of that work and no doubt the diversity of the field. One only needs to look at the latest issue of the journal Psychotherapy, one of the preeminent journals in the field published by the American Psychological Association, to see how today's program aligns with exactly where the field is at. Reviewing the table of contents, we have cognitive behavioral therapy, motivational approaches, psychodynamic treatment, emotion-focused work, attachment, alliance, mindfulness, and group treatments. Our focus today is exactly where the field is situated. And indeed, it's lovely to see that several of our presenters have their work referenced in this very journal today. The Mental Health and Addictions Program is really so very proud of all of our colleagues who are presenting here today, not only for their clinical service and contributions to the program, but also to innovating knowledge that really is advancing the field of psychotherapy. And with the recent creation of the education and training program within our provincial program, which has a focus of building capacity to deliver evidence-based treatments for the mental health and addictions workforce, clearly we are in good stead to have these colleagues in our midst. So I know you will enjoy the day, and in the spirit of our namesake for today, Dr. McCormick, the loonie in my pocket at the end of the day will go to the audience member who correctly identifies of today's presenters who has the most frequent citations in this very issue. So thank you.